The big thing with menopause and perimenopause is that everything starts to dry out, including your skin.
Introducing the Perimena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Perimena Bliss Podcast.
Hey, this is Doc Yates. Welcome to the Perimenopause Bliss Podcast, brought to you by perimenopause.com. And today I want to talk about some very common things that I see in practice causing dry skin. Now, some of these are specific to perimenopause and menopause, but some of them are going to just be, just specific to anyone dealing with dry skin issues, with the exception of the hormone part, of course. But since it is the Perimenopause Bliss Podcast, we are, of course, going to be talking about hormones as well. So let's dive right into it. Some of the top causes of dry skin that I see in practice. And you know what? Let's start with the hormones. When you start to lose estrogen and progesterone, things start to dry out. And I mean, everything starts to dry out. One of those being your skin. So when you want to make sure that you're getting your hormones checked right off the start. If your estrogen levels are low, if your progesterone is off, and if you're going to the lab, you might as well get your thyroid checked too, because if your thyroid is off, all three of those hormones, thyroid, estrogen, progesterone can all affect your skin and lead to causes of dry skin. That's why some people get so confused, because there's such an overlap of symptoms between these different systems. Let's go to number 2, fats. You need healthy fats in your diet to have nice skin. Your body depends on healthy fats. So you want to make sure you're getting a lot of omega-3s in your diet. Omega-9 is good. So when I say omega-3s, you generally want to think of fish oil. People often say flax oil. No, think of fish oil. Then you want to think of olive oil, and you want to think of healthy, like medium chain fatty acids, in which case we're just going to say coconut oil. So you want to make sure that in your house you have olive oil, coconut oil, and fish oil. All of these things are going to be important for healthy skin that is not dry. The third thing we're going to discuss for dealing with dry skin is moisturizers. Now, you can use these exact same things for your skin to help lubricate your skin. So from outside, now, you don't want to use fish oil on your skin unless you want to stink and have no friends. But healthy fats, healthy oils that you put on the outside of your skin, you want to make sure you get ones that have lots of antioxidants built into it, because we're going to combine those points with the healthy moisturizing plus antioxidants, because that can help protect your skin from drying out. So you can get, say, something like a shea butter, a grapeseed oil, a coconut oil, some olive oil. These things are often all mixed together, and you can put that on your skin. And it's better to use these natural oils on your skin as opposed to all the synthetic crap. So get some natural oils. Often they have vitamin E added into it. And that's for 2 reasons. One, the vitamin E helps make the oil, prevents the oil from going rancid, but then it's also a benefit because it's adding it to your skin. So a lot of times when they're promoting the vitamin E, they put it in there to protect their product, not for your skin, but you get the bonus. Now, antioxidants still apply internally too, so you want to make sure that you're getting all of the antioxidants, fat-soluble vitamins and vitamins all built in. So taking a really good multivitamin and then ramping up the antioxidants, especially if you're doing things like smoothies with berries. We use that Revive Effects powder that I've created, and I basically took all of the strongest antioxidant plants. So we took things like Hishu Wu, and we took green tea extract, and we took elderberry extract and triphala, and all of these things, and put them into one powder so you can just put them into your smoothie. But again, the more antioxidants you can get in, the better for your skin. Now, the next thing I want to talk about, if I can see my notes here, is, avoiding harsh soaps. The more you are washing your skin, now a lot of people learned this the hard way over COVID, The more you're washing your skin, the more sanitizers and things that you're using, you're washing your own healthy oils off of your skin, and then you're drying yourself out. So yes, it's important to wash and be clean, but don't overdo it because you literally are drying your skin out, which can lead to more issues, dry skin and cracking skin, which makes you actually more prone to infection. So, wash, but don't overdo the harsh chemicals and soaps. And if you're someone who's in an industry where you have to wash, say you're getting, a lot of like harsh oil, say for instance a mechanic, you're better off wear the protective equipment and gloves so that you don't have to be using such harsh stuff on your skin all the time. The next point I want to discuss when it comes to dry skin is food sensitivities. Now, this is not specific to perimenopause or menopause at all, but if you've always had really chronically dry skin, if you've been prone to eczema, those types of skin issues, you have to look into food sensitivities. This is an absolute must. It's extremely rewarding to do this with kids because the results are so fast. Now, it's difficult to do with kids because kids are picky eaters, but when you make those changes, you can see a kid covered head to toe in eczema go away within a week when you cut out those problematic foods. Now, for adults, it's not going to be a week. It's going to be more like a month, sometimes 2 months, but you cut out the most common problematic foods, which in my experience, I would say would be things like wheat, dairy, sugar. Those are definitely the top 3. After that, it kind of varies. I'm not sure if I could say soy and corn would probably be up there. Now, the last point for things that can lead to dry skin is that if there's any medications that you are consistently on, if that timeline checks out, you need to ask your doctor, you know what? Ask your doctor and ask your pharmacist and look it up on your own. Because if you see anything where the common side effect is dry skin, it will make you question if the timeline with regards to that medication and your skin issues. For instance, things like chronic use of antihistamines. Antihistamines will completely block your histamine. Histamine does serve some benefit as well. It's just when you have excess histamine that becomes a problem. So when you block it completely, things can dry out. There's certain blood pressure medications that can dry out your skin too much as well. So check with your medication list, check to see if the side effects are dry skin, and then check to see, if you've had dry skin for 10 years and you just started that medication in the last year, chances are it's not that. But you need to look into that timeline. So I hope this information was helpful if you're struggling with dry skin in general or in perimenopause and menopause. I hope this can be helpful for you. This is Doc Yates, and I am signing off.
Thank you for tuning in to the Perimenopause podcast. Don't forget to hit the subscribe button and visit perimenopause.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenopause podcast.